So I really thought of myself as a very healthy person who wouldn't get very sick. And the reality is that I actually wasn't able to leave my bedroom for 22 days.
I work in healthcare, have for 42 years, and so of course when this all came down, we have to be very, very vigilant. And I have been so vigilant, it's been ridiculous. Wear my mask every day to work, wear it all day at work, washing everything I touch, definitely sterilizing my hands all day long. And literally when we were in lockdown, going to and from work, period, and the grocery store once a week. And that was the extent. And I truly believed that I would dodge the bullet. Well, I let my guard down one time to go on vacation, fly fishing in the middle of Montana with another couple. And unfortunately, 2 days into the trip, I said, "Are you sick?" And they said, "Yeah, we've been sick for 3 or 4 days." And I said, "Well, lovely." That isn't what I said, but you know what I probably said. But the fact of the matter is I knew as soon as I heard that cough that I was doomed. And I am a very, very healthy person. I have no comorbidities at all. And I had every symptom for 12 days. I was sicker than a dog. Literally 2 days after exposure to them, I was laid up with the worst cough I've ever had in my life, congestion, woke up like that. There was no warning. When you get the flu, you kind of ache all over. There was nothing like that. I woke up like on death's door.
So for me, the symptoms were like nothing else I've ever had before, in that I would have waves of symptoms that would change by the day. So one day I might have just raging headaches and eye pain. I actually had like swollen eyes and a lot of eye like pressure behind my eyes. And then the next day that might be much less, but now I would have like a horrible stomach ache, and throughout the whole time I had like extreme pain moving around my body, hurting my muscles, my skin. I felt like my hair even hurt sometimes. It was just like I was just like a living pain. Yeah, just a ball of pain. And then I didn't actually have a fever. So I had one day that I got just a little over 100 degrees, but like really not where you would consider like an extreme fever. And I was one of those people that was like checking my temperature every day to like expecting to spike a fever. None of that happened for me. And actually quite a few of the people that I've been in touch with since then, and I've asked them about their experiences, they also didn't have a fever. So I really want to get the message out that you cannot use your fever as an indicator of whether or not you do or don't have COVID. If you have a fever, it's a good reason to go get tested, but it's not that if you don't have it, you're in the clear.
12th day I woke up and every symptom was gone. Every single symptom, as fast as it came on, it left me. But those 12 days, let me tell you, it kicked my butt.
The recovery time from this has been pretty challenging for me, and building back up my stamina has been really challenging. Those were things that if you had told me beforehand that a cold or a flu or a coronavirus could do that to you, I just wouldn't have really believed it, especially, being a fairly young person myself. So it was a surprise, and not the good kind.
This isn't a conspiracy. It's real. We haven't had anything like this in our world since the Spanish flu, and that killed millions. I mean, the chances of you dodging this bullet, slim, very slim. I would have never in my life ever thought I would have caught it. And the person I caught it from literally got on a plane, doesn't wear a mask, got on a plane, flew to Georgia to a family reunion. Never got tested. And I'm like, why? Look at the people you impacted.
Okay, so I can totally understand if you're one of those people who think that COVID isn't a very big deal. or you think it's like a cold or a flu, because there are a lot of high-profile people in this country and around the world who have had mild cases of it. And thank goodness there are mild cases, because we'd be in huge trouble if there weren't. But I think that when you look at the law of large numbers, and here we are in a country of 330 million people, there's a whole spectrum of experiences, and you don't know if you're at high risk for one of those more severe experiences. This is something that I feel like a lot of people think, oh, I don't have diabetes, or I'm not on chemotherapy, or I'm not on an immune suppressing drug, so I'm going to be okay. And the truth is, we don't know enough about this disease to determine who is at more risk for a more severe case. So yes, age is a definite indicator for death, but there's a lot of other things that can really hurt you besides just dying. And like, I'm so thankful and so fortunate to have survived this, and everyone that I've known who's gotten it has survived it as well.